All right, today we're diving into a drug that feels a little bit like science fiction. It's called Cangrelor, and it tackles a huge paradox. How do you stop a life-threatening blood clot, but only for an hour? This is a serious game changer in heart procedures. So, let's just start with the central puzzle right away. How on earth can a doctor give you a super powerful anti-clotting drug and then have its effects just vanish an hour later? I mean, it's this incredibly delicate balancing act where a person's life is literally on the line. So let's break down exactly how they pull this off. Okay, picture this. We're in the cardiac catheterization lab. A patient is having what's called a percutaneous coronary intervention, or PCI, to open up a dangerously clogged artery. Now, this procedure saves lives, but pushing a stent or a balloon into an artery, well, it damages the vessel wall. And what does the body do when it senses an injury? Its first response is to form a clot. Right there, the exact place you absolutely do not want one. And that creates this massive dilemma. Doctors have to stop a clot from forming on that brand new stent. But the traditional blood thinners, they can leave the patient at a really high risk of bleeding for days and days. What they desperately need is an on-demand solution. A drug that works like a sledgehammer, but only for the short time they're actually doing the procedure. To really get the solution here, we have to shrink down, like way down, to the microscopic level. It all comes down to controlling the body's tiny little first responders, these cells in our blood called platelets. So here's how it goes down. It's a chain reaction. First, the blood vessel gets injured during the PCI. Instantly, the body sounds the alarm by releasing a chemical signal called ADP. This stuff floods the area, and it's looking for one thing, a specific docking port on the surface of all the nearby platelets. When it connects, bam, it's like flipping a switch that makes the platelets super sticky, causing them to all clump together and form that clot. And that docking station, that all-important activation switch, is called the P2Y12 receptor. This is the key to everything. If you can just find a way to block ADP from hitting that receptor, you can shut down the whole clotting party before it even gets started. And this is exactly where Cangrelor comes into play. You see, it's designed at a molecular level to be the perfect shape to fit right into that P2Y12 receptor, physically getting in the way so ADP can't. It's basically like putting a temporary custom-fit lock on the platelet's on switch. As long as Cangrelor is there, the platelet just can't hear the command to get sticky and form a clot. Now, blocking this receptor, that's not a totally new idea. But what makes Cangrelor so incredibly special is its precision, and, more importantly, its control. This is where the drug truly becomes a superstar. It has what you could call the ultimate off switch. First off, it is unbelievably fast. When a doctor starts the IV, Cangrelor goes to work and blocks over 90% of the platelets in just, get this, 2 minutes. In a critical heart procedure where every single second is vital, that kind of speed is absolutely revolutionary. So let's put Cangrelor head-to-head with the traditional pills, like clopidogrel. First, just look at how fast they work. The pills, they take hours to kick in. Cangrelor is basically immediate. Next, the binding. The oral drugs bind irreversibly. They basically kill that platelet for its entire 7 to 10 day lifespan. But Cangrelor's binding is reversible. And that reversible part is what leads to its most important feature of all, the offset. The very moment the doctor stops the IV drip, the drug just starts to disappear. Its half-life is only about 3 to 6 minutes, and within just 1 hour, 60 minutes, the patient's platelets are back to business as usual. That is the off switch in action. It gives doctors this incredible, unprecedented level of control over something as fundamental as a patient's blood clotting. So with this totally unique on and off ability, where does a drug like Cangrelor actually fit into the world of medicine? Let's take a look. Okay, so its main job is during those high-risk heart procedures, stopping clots on new stents. But it's also the perfect bridge therapy. Just imagine a patient who's on a daily blood thinner pill, but they suddenly need emergency surgery. You can't operate while that pill is still working. So with Cangrelor, doctors can stop the pill, use the IV drug to keep the patient safe right up until surgery, then just turn it off. An hour later, their clotting is back to normal, and the operation is safe to perform. It's brilliant. But no drug is a magic bullet. Every powerful tool has its trade-offs. So let's get a balanced look at the whole picture. The pros are pretty clear, right? It's immediate, it's predictable, and it's rapidly reversible, which is a massive, massive safety win. But the downsides, well, they're real. First, it's very expensive. And because it's so potent, there's always a risk of bleeding.
It also has to be given through an IV, which is complex, and for some patients, it can cause a temporary side effect of shortness of breath. So when you put all the pieces together, what is Cangrelor's real place in modern medicine? What's its legacy going to be? You know, a quote from a medical journal just sums it up perfectly. It describes the drug as having a fire extinguisher-like effect. Think about that. You use it in an emergency for this immediate, powerful blast to put out the fire, but its effect is designed to be short-lived. It's only there to manage the immediate crisis.
And that's the key takeaway here. Cangrelor was never meant to replace the daily pill a patient takes for years. It's a specialist's tool. It's a powerful, controllable bridge that gets a patient safely across a very dangerous, very short period of time before handing the job right back over to the long-term oral drugs.
And that kind of leaves us with a really fascinating question to chew on. In the high-stakes world of medicine, where the line between a dangerous clot and dangerous bleeding can be the line between life and death, a drug like Cangrelor really makes you ask, is precise control sometimes even more valuable than just raw power?